So you guys, I recently came across a post that was talking about kidney dialysis, and I was like, let me talk about something. I want to share some information, and this is to create awareness. Disclaimer, I don't practice medicine. I've never studied medicine. So the things I'm going to talk about are things based on my own experience and those of the people that are close to me. Okay? This is information that I've got from doctors and also information that is there on the medicines that you take. So this information is basically about self-medication. So let me tell you something, guys. I think most of us, if not all of us, have a tendency of self-medicating. Self-medicating is simply when you just go to the pharmacy, buy something that has not been prescribed by a physician or a doctor, and then you go ahead and take it to treat you of something, okay? So when you go to the pharmacy, the pharmacist usually as I was saying, the pharmacist will always just give you what you ask for. Most times, unless unlike in some countries where they will ask you for the prescription, but in most cases they don't mind. Most of the medical industry is more about the money, and we all know that. Anyways, I will start with the most basic thing that all of us have in our houses, or maybe some don't, but most of us. These are painkillers. There are different painkillers from brufen, paracetamol, and all sorts of painkillers that other people use. I cannot mention them all. I don't know all. But anyway, I'll give you an example. For example, what I have here. There is this. This is a painkiller. And if you look down there in its ingredients, there is paracetamol 500 milligrams plus brufen 150 milligrams. It's down there, okay? Then at the same time you have this, okay? This also has ingredients, okay? Paracetamol 500 milligrams. And then I have this. It's for flu. See? For flu, headache, and all those things. If you read behind it and you see the ingredients that it contains, it has paracetamol 500 milligrams and some of them I cannot pronounce. Hydrochloride 30 milligrams, like that, and others. If you read, you'll see them. And then there is this one. You have to take it in hot water, and it also has paracetamol. So what am I saying? When you go and look at these leaflets that they put in all those medications, my dear, let me tell you something. It's not a mistake. It's not a mistake that they are putting for you these papers. But most of us, including me, are very, very lazy to read. Very lazy, trust me, to read. And you miss all the important information here. These things usually talk about the allergies, the side effects, the dosage, the ingredients, and the do's and don'ts of these medications. And most of us don't read. Some of us all out there have babies that you also go ahead, have medicine in the house, and when your baby is sick, you just grab and give because we think we know it all, or because you think you have the experience. No. You're harming yourself, you're harming your child, you're harming your family, because you have a box full of medicine there in your house that you keep using over and over again. Some of you don't even check the expiry dates. I'm someone who has battled with kidney issues, so I'm speaking from experience, and I'm telling you, you're killing your kidney, you're killing your immune system, because these papers, if you go there, I cannot read everything because it's a lot, but if you go and read, it's even clearly said, check before you take. I don't know if you can see down here. It says check before you take. And it clearly tells you, even some medications tell you, if you're breastfeeding, if you're pregnant, if you're like this age, don't do like this. But most of us just go ahead and take. This one is saying, do not take if you have ever had an allergic reaction to paracetamol or to any of the other ingredients listed in those sections. Remember, when you go to hospital to get medication, some hospitals will test, even will give you a test to see if you don't have allergy. If you don't know if you have any allergies, like if you have any allergic reaction towards certain ingredients, they will try to give you a test before prescribing, which when you just go to the pharmacy, you don't get. So it says, if you're taking any other prescription or non-prescription medicines containing paracetamol to treat pain, fever, or symptoms related to flu or help you sleep. I'll tell you something, all medications have a dosage, and they will tell you, for example, paracetamol, you have to take like 500 milligrams in like 4 hours. Okay, so what some of us do, including me, I've done before, you have a flu, you have a headache, you have back pain, you have some other pain, cramps, and all sorts of things. So for flu, you'll take Panadol flu, then get another painkiller, maybe Brufen, for your cramps, then get another painkiller, like within a span of 4 hours, or even in the same time, you're taking like 3 tablets or 4 tablets that have the same ingredient with a dosage of 500 milligrams. What are you doing to yourself? You're overwhelming your liver, you're overwhelming your kidney. Your kidney is supposed to filter all the poisons and toxins. You know what I mean? I don't understand medical language. I already told you I didn't do medicine. But layman's language, your kidney filters, and all the toxins will come out through your urine. But if you overload it, what happens? You're damaging it. And in the end, what is happening? Your kidney will fail. So you see those people who are on kidney dialysis? This is helping, that is helping them to filter. That is helping, because the kidney cannot do its job anymore. Trust me. And if you keep doing that, overdosing and abusing medicine, you could die. You could die. It's a reality. I've seen it happen. You will faint. Have you ever taken medicine and then you feel dizzy after taking it? Because you're overwhelming your system. You have a dosage that you've gone way beyond what you're supposed to take. So I can't talk enough. Just go read the instructions in your medication for anyone who has medicines at home. There are some people who who use contraceptives. Do you read what those contraceptives do to your bodies? Or do you know the side effects? There are people who are taking, ladies especially, who are taking folic acid or Pregnacare, all those female medicines. Have you read the ingredients? I'll explain to you next time. Bye.